So I am officially IVF drug free, and I wanted to do this video last week because my official end date was Valentine's Day, and I thought I was going to do this like big Valentine's thing with rose petals, but then I was just tired. I think I had enough instead, so I didn't film. So I had a few problems a couple of weeks ago, and I think I might have mentioned it in one of the videos that I was just feeling horrendous. Not sick, I was so dizzy. Every time I stood up I felt like I was going to fall over, and there was one week, I guess that was about 3 weeks ago, that I was just sitting on my sofa crying. Every time I stood up I felt like I was going to fall over. I remember getting halfway up my tiny flight of stairs and just sitting there sobbing. Tom works upstairs, well, up here, and I just felt so pathetic. I was so dizzy, and obviously my job is awful for feeling dizzy when you're teaching exercise, and horrific migraines that I couldn't get rid of. So I rang my fertility clinic and spoke to them, and they said don't just stop because the baby might die, which then scared me. And I wasn't asking to stop. We just read up a lot that the side effects we were having, that were even in the leaflet of the progesterone pessaries I was taking, that you're having too much of a dose. And this baby just seems really strong, and it's been a little bit ahead since the first scan. Since our 6-week scan, it was measuring 5 days ahead when it was just a bean. You can see that video in, I'll put the link there to how big it was in 6 weeks. And it took them 4 days to get back to me because they had to wait for the consultant to actually review my notes, and then they said you can stop. That was the 6th of February they said I could stop, because it was when I was in the hotel for the Lorraine Kelly show that they rang me. But then I was really scared, and I think most people that have had IVF are really petrified that suddenly you're like leaving yourself, your baby, almost to fend for itself on its hormones. So I didn't. Instead of taking my 3 lots a day, so I had 2 pessaries and 2 estrogen tablets 3 times a day, I just went down to once a day from Wednesday the 7th, and it was almost instant that I felt better. It was absolutely ridiculous. And now, apart from being tired and the odd headache, which I think is due to dehydration now, not migraines, I feel so much better. I'm not as tired. I don't have head, like, yeah, the migraines were terrible, nothing would touch them. And I did, a couple of occasions I did take paracetamol, but I don't like taking medication anyway, and especially I don't want to take it now. I've got a little one in me, I haven't got it yet. Oh, they were horrific. I was just down in water and it just wasn't getting rid of it. So, and also my boob pain has completely reduced. I've actually dropped, I think, 2 or 3 pounds as well, because I think I mentioned it in one of my videos, I was really worried about how much weight I'd gained. So I have gained a stone, but that is since the start of hormones in total. So again, if you kind of skip back my videos, when I started the quadruple dose of HRT in September, that's when my weight gain started. So I think it's a little bit hormone induced, but possibly stress induced eating. I'm not eating as well as I used to, just because my appetite's completely changed, as most people's do. So yeah, it's now been 6 days since I've been off them, and I feel so much better. I did have a scan last week because I am a worry head, and because I'm not really showing, I was worrying that the baby wasn't okay. So I did that just to ease my mind. I've spent so much money on private scans. It's ridiculous how much money we've spent. But it was really good, and baby's doing okay. And I'm going to do a video about that in a second, of my 14-week scan. And it's fine, and the placenta is fully formed. I think they could see my placenta starting at week 8. And it was week 9 to 10 that I felt really ill. So when the placenta's forming, the baby starts producing like more progesterone itself, and it's kind of self-surviving there. So you've got that, and then what you're taking on top of that, and it was just too much. I'm just thinking back to how crappy I felt. It was awful, and I didn't like complaining, because obviously those little drugs have given me the chance to carry a baby and grow this baby. So I hated feeling very negative about being pregnant, and it wasn't negative at all actually, but I just was really worrying that I was going to be like that the whole time. So it's good. So yes, I am hormone free until I have the baby and then get the menopause symptoms again and then have to go back on HRT, but we'll face that. That would be like a nice Christmas present, wouldn't it? So yeah, that's a little update. Thanks for all the support and the messages, and thanks for those that have sort of seen the paper articles I've been in, and I really hope I'm doing you guys proud. It's been hard actually talking about the story because I hate talking about my teenage years because it sucked. It really sucked, and it's quite good to see that there's some people like mums that have got teenage sufferers and stuff like that, and even I've had like this really sweet girl that's like 20, 21 messaging me saying she's so grateful that I've done these videos and she doesn't feel alone, and she got diagnosed when she was like 16, 17, and that's what I wanted to do. It was around that age, 16 to 21, I just felt like I was like, I don't know, weird, a freak, and I don't want people to feel that way. So yeah, my little kind of touching back on the past is helping, so it's good. I've got maternity jumper, and it's only a size 12, but look at this. I like it, but it's like huge. I'm like, am I going to grow the bump up here? Weird. Anyway, see you in the next one. Bye.